Hello, I'm Dr. Liz Swenson. I'm an OBGYN and the medical director here at Teal Health. Today, I wanted to walk you through a little information about what we do during our new patient visit when patients come through and get ready to screen with the Teal Wand. When you meet with your provider at Teal, we're going to make sure that you feel confident and comfortable to do the screening at home yourself. So this is the Teal Wand. I usually say it looks most like a medium tampon in the diameter, but it is longer than a tampon. Let's just compare the length. Our design is intentionally longer than necessary just to make sure it works for everybody's body type, to make sure it stays comfortable no matter how tall we are, how long our torso is. We want it to work for everybody. When someone's ready to insert, I usually cancel that you're only going in a few inches typically until you meet up with a little bit of resistance or pressure. This could mean you're hitting the back vaginal wall or near your cervix. At that point, you're pushing the screen dial forward to get this sponge to come out. It's a very soft sponge, much like a cosmetic sponge is how I describe it. Once that's out, then we have you turn the dial about 10 times to rotate the sponge and collect the sample. And just remember, this is collecting a vaginal cell sample. So it actually does not have to touch your cervix, because if someone has HPV, it is really everywhere, including the cervix and the vaginal walls. Once you're done turning the dial 10 times, then you can retract the sponge back into the device and remove the wand. The next step is getting the sponge into the vial. So you're going to push that dial up one more time. And then these little side arms can be brought down out of the way completely. So you can grab it right at the base and then just pull straight upward. That will pop the sponge off with that little plastic stem that goes right into the vial. You put the cap on and then put it in the safety bag and then the mailer bag. And that can be put right into your mailbox at home, ideally within 24 hours of collecting. Once that is processed from our lab, we will get the results back, review those, and then we'll release them to you in your portal, usually within a week. If your results are normal and you've had normal results in the past, the next screening would be due in 3 years, and we'll reach out to you to remind you. If you have a positive HPV result, then we do want to see you back for a second conversation and answer your questions, make sure you understand what the positive test means, and help you find a provider to be seen with in person. Please reach out to us throughout the process if you have questions or need any support, but we are confident that you can do this at home, comfortably, and on your own terms.